Steward Health Care, which runs several hospitals and urgent care centers across Massachusetts, is on the brink of financial collapse, and their patients are paying the price. The National Healthcare Network owes around $50 million in unpaid rent, which has already forced hospitals in Massachusetts to close. And in at least one of their hospitals, life-saving medical equipment was repossessed. Medical reporter Jessica Bartlett has been doggedly covering this story for the Boston Globe. She joins me now. Jessica, thank you so much for being here and for your reporting. So you were the first to break this story. What's going on with Steward?
Yeah, so Steward is under tremendous financial strain. They haven't been paying their vendors for some time. There's at least 14 lawsuits in Massachusetts. I do want to be clear, only one hospital in Massachusetts they've announced closure of, but there are a lot of concerns that they might not be able to continue operating their facilities, particularly because their landlord in a public statement said that Steward nationally would be looking to sell off some of its hospitals in order to kind of recoup some of the debt that they're facing.
And you mentioned, I know you did this report on this woman, Sungita Rashid. Am I pronouncing that correctly?
Sungita Rashid, yeah.
Sungita, I'm sorry. She was affected by a piece of medical equipment being recalled. Can you talk about that?
Yeah, so Sungita came with her husband, Nabil Haq. She was 33 weeks pregnant. They are a Bangladeshi couple. They'd gotten their PhDs in the States and then moved abroad for work and came back for work. And she delivered at St. Elizabeth's Medical Center in the morning, and by the afternoon wasn't feeling well. And so they did some tests, discovered she was bleeding in her abdomen, and took her in for an operation. Now in the OR, they realized that the coils, these embolism coils, which are these metallic things that they insert through the veins, were not there to help them stem the bleeding. So they had to transfer her to another hospital, but she did not make it. And experts say, in any case of trauma where you have kind of serious bleeding, time is of the essence. And the manufacturer for those coils, Penumbra, had said weeks prior that they were going to repossess their supplies at the hospitals because Steward had not paid their bills.
Steward, yeah, they haven't paid their bills, they haven't paid their rent, and her story is so heartbreaking because I think it's a key example of a much larger problem. I mean, just how big of a crisis is this for the state and for healthcare across the state?
Yeah, so not only have patients not been able to get necessary health care in the last several weeks, but some people are saying this has been going on for months, that patients have been calling for several months trying to just get appointments and haven't been able to get through. Their primary care docs told one patient, well, you can't get through because we don't have enough staff to answer the phones or return phone calls. Some patients couldn't get surgery scheduled or have surgeries postponed or canceled because they didn't have the necessary medical equipment. Mass General Brigham pulled their doctors out of a Steward facility recently because of supply problems. And so these have been persistent challenges that have kind of hampered healthcare around the state, and in so doing, put pressure on those that remain to kind of accommodate the care that they're not getting elsewhere.
Yeah, I mean, this would affect other hospitals as well. There's been some pushback from intervention from state leaders at a Massachusetts congressional delegation earlier just last week. They wrote a letter saying that a briefing on Steward's financial position, they were asking for the status of your Massachusetts facilities and your plans to ensure the communities Steward's hospitals serve are not abandoned. They have not disclosed what their financial situation has been to the state. And so there's been some intervention from state leaders. I know you wrote about Elizabeth Warren being suspicious of their claims, right? Because they've said that they don't have any money, and they've done this in other places as well because of Medicaid billing. That's the line from Steward.
Yeah, so Steward is blaming a lot of their financial problems on reimbursement rates. And so it is true that they have a higher mix of patients in their hospitals that are on Medicaid and Medicare, which typically reimburse less than commercial insurance. And their commercial reimbursement rates are lower than some of the academic medical centers in the state. Steward has pointed to those as the reason why they're facing these financial problems and challenged legislators to fix those things. But Warren and others, most recently today, Congresswoman Trahan said, they really questioned that premise. They've noted that Steward has closed facilities in Texas most recently, citing the same kind of concerns. But Steward is a for-profit system that was formed through a private equity venture. And so there are a lot of questions about what role the private equity group played in the decisions that they've made that have put them in this predicament. And was it truly just Medicaid that were the source of their financial distress?
You mentioned, let's hear from State Representative Lori Trahan at a congressional hearing.
For their reasoning, Steward executives have pointed to, you guessed it, low Medicaid reimbursement rate as the cause for their financial distress. But earlier this month, it was revealed that the company has missed rent payments to an outside landlord that actually owns the property and buildings their facilities operate in. It's looking more and more like this is part of a dangerous Steward private equity playbook.
I mean, what do you make of this? What does the hospital do right now? Obviously, there are multiple things going on, right? There is a looming crisis. I think you mentioned they have until the end of the month to kind of explain what's going on. Patients have already been affected, but if I'm a patient and I regularly get medical help, or I go to a medical practice that's run by Steward, what should I be doing now?
Yeah, so I think the first thing is for patients not to panic. The one closure that Steward has announced in Massachusetts thus far is a rehab hospital, and their plans for other hospitals have not yet been made clear. So there aren't yet any closures on the docket. They do have to tell the state if they're planning on those closures. That hasn't always been the case that they've followed those rules in the case of Quincy Medical Center, where they only gave 60 days notice as opposed to the 90 days that they're supposed to give. But typically, we would have some kind of notification of a closure. But that said, patients should stay in touch with their doctor. Talk to them about if they're concerned about accessing medical care, if they've got prescriptions they need more urgently than like an annual doctor's visit. And if you're truly concerned, just knowing where you would go in an emergency were something to shift. But I think the biggest thing for now is not to panic while we get a better grasp of what the kind of lay of the land is. Now, Steward did tell regulators, sources have told me that they had till the end of the month, according to their lender, was pressuring them to have a plan by then. But there wasn't even confidence if that timeline was true. As of today, we don't yet have any plans from Steward. So we're still kind of waiting to see what are their next steps and what does that mean kind of for the state long term.
And it sounds like a lot of the doctors are really concerned as well, because you've reported that doctors have been reaching out to other hospitals to ask if they could be transferred. And your colleague John Chesto wrote recently about a possibility of Mass General Brigham absorbing Steward. Where is that plan at? Is that a reality that looks likely?
I think a lot of people are looking to Mass General Brigham as this white knight or savior, given their size and scope in the state. Whether they're going to take on some or all Steward facilities, I think, is unclear. I think it's unlikely they would take on the vast majority. They might play a role in some kind of situation moving forward. Steward has told state officials that it has an interest in transferring ownership to other health systems, but it's really unclear if MGB wants to play that role and to what degree they might. And so I think a lot of those conversations are underway as well right now. But as you mentioned, in the interim, a lot of doctors, there are a number who have stuck with Steward Health Care. They're committed to these communities. But a number of them are trying to just care for their patients. And so in order to do that, they're asking for credentialing permission from other hospitals to do their surgeries there. And so these doctors are trying to find any way to care for patients in the interim as all this stuff happens. And as we wait to see what other health systems might be in the mix, what Steward decides, I think everyone is waiting for Steward to make the next decision and to react from there.
So the doctors might be able, like you said, patients should reach out to their doctors. And if your doctor has a plan for transition, maybe you can be a part of that. I don't know. It's so much is up in the air. Can we talk about Norwood Hospital? So Norwood Hospital closed, I think, almost 4 years ago. They had severe flooding. They've been under construction. They're part of the Steward system. How would this affect that? They're supposed to open, I think, in 2025.
Yeah, the timeline for Norwood is really unclear. The construction has been slow going. They've got steel in the ground from pictures that I've seen, but I don't really know if they're making a lot of progress. And so it's really unclear if Norwood would even be, the construction would continue there, who might occupy Norwood if Steward were to transfer ownership or close it. But the closure of Norwood and the catastrophic flooding that took place there in 2020 has taken place in a broader context. You also had the fire at Brockton Hospital in 2023. You had Quincy Medical Center transitioned to a satellite emergency room. That also closed in 2020. And so all of those closures, particularly in the southeast region of the state, have put a ton of pressure on those that remain. For example, South Shore Health, they count 374 licensed beds, but on average, they are seeing 500 patients a day with peaks that get up to 560. So far more than they are typically accustomed to caring for. They're disaster planning on a daily basis to accommodate the volume. And so that's just kind of an example of how some of these closures in the past have already stressed the remaining facilities. This is on top of a capacity crisis the state is facing at large. And so whether other facilities could accommodate patients coming to them really depends on the region, but it's certainly a region-wide crisis in where Steward facilities are.
Great. Jessica Bartlett, thank you so much for your reporting. Thank you for joining us today.
Thank you for having me.